This is a relay project.
Real Talk starts right now. Here's Ryan Jesperson.
We're talking healthcare in this episode of the show. Grateful to have you with us in just a moment. Technically, she's not Alberta's health minister. She's the Minister of Primary and Preventative Health Services. This part of the big reorganization of Alberta Health. We'll be sure to ask the Honourable Adriana LaGrange about that in just a moment. Of course, you know, if you're a regular listener to this show, if you're watching the news, that Alberta's moving to what it's calling a dual delivery healthcare model. This is kind of a public-private hybrid. The province has been communicating to Albertans on what the sacred cow will be. In other words, what will be untouched. I know a lot of people are concerned that it'll mean they won't have access, or that they'll have even less chances than they already have, low chances of finding a family doctor. People are concerned about things like healthcare surgeries, but the province is insisting that this is a way to address wait times and other inequities within the system. Obviously, metrics that aren't meeting the standards that both the government and that the public has. A little bit later on in this episode, we're going to talk to two former UCP MLAs. They've got their own thing going on. Peter Guthrie and Scott Sinclair are going to join us to bring us up to speed on this initiative they have to kickstart the progressive conservative movement. Again, it's running into interference from the provincial government. They say that they're trying to capitalize essentially on their intellectual property. We'll get the goods on that. Plus, we'll take you out to Jasper, as we do every Wednesday, courtesy of our friends at Tourism Jasper. You know, I've got this incredible bottle next to me here. We're one of the only modern talk shows, John, I think, on planet Earth that do their big interviews with bottles of whiskey on the table, and that is because we are proud partners at Hanson Distillery. They're presenting this episode of the show, and Hanson has proudly just released its first ever, and as a matter of fact, it's Edmonton's first ever 7-year aged whiskey. This is the Northern Eyes whiskey, a phenomenal product, handcrafted with 100% Alberta rye grain and aged in a single American oak barrel. There's just 400 bottles of this, and they're selling fast. The first ever 7-year aged whiskey released in the Metro Edmonton region. You can get your hands on it online no matter where you're listening. If you're across Canada at hansondistillery.com, you can always pop into the distillery. It's a beautiful location in our home city of West Edmonton, just north of Mercedes-Benz Edmonton West on 174th Street, 111th Avenue. Or you can find Northern Eyes whiskey, the 7-year aged edition, at fine liquor stores across the province of Alberta. Hanson Distillery proudly presenting this episode of Real Talk. Well, Alberta's government is rolling out what it calls a dual delivery healthcare model. This is a public-private hybrid that Alberta's Premier Danielle Smith and Minister Adriana LaGrange insist will shorten wait times, improve access, and most importantly, probably just modernize the system, bring it up to speed. But critics say that it's a slippery slope to two-tier healthcare, where those who can afford it, those who can pay, are going to get in faster while everybody else waits longer. And I guess that's probably, to be blunt, the biggest question that's hanging over all of it. Staffing, too, right? Alberta's facing well-documented shortages of doctors and nurses, not to mention paramedics. So where exactly are these promised efficiencies going to come from? Will private clinics be able to generate or recruit new personnel, or are they going to pull them out of the public system that most people rely on? Here to shine some light on the situation, to take my questions and yours in our Real Talk live chat powered by Park Power, is Alberta's Minister of Primary and Preventative Health Services, the Honourable Adriana LaGrange. Thanks for making time for us on the show today.
My pleasure, Ryan. Good to see you.
Good to see you too. I've interviewed you as the Education Minister, as the Health Minister, never as the Minister of Primary and Preventative Health Services. There's almost, maybe not technically, but basically there's a number of different health ministers right now. How is the reorg working out? How are you adjusting to it? And are you finding some return on the big change?
Oh, absolutely. The fact that we have now 4 ministers that are focused on their key areas, They're priority pillars. I call them pillars of healthcare. When we have somebody totally focused on mental health and addictions, we have someone totally focused on assisted living and seniors, and the whole continuum of looking after a senior and also those with severe disabilities, etc., from the lightest touch to the most severe touch. When we have someone that is focused solely on acute care and hospitals, we are starting to see those results. And myself, I'm still the oversight minister, but I'm also still very focused on primary and preventative health. And I can tell you we're making great gains in terms of attracting new physicians to the province. We have seen the numbers go from roughly about a stagnant number of roughly about 10,600 physicians in the province in 2018, 2019. We're now at 12,769 and counting, more coming all the time through the work that we've done with the College of Physicians and Surgeons. We've also seen an additional 106 medical residents who are now taking contracts to work in rural remote locations on 3-year return of service. They are getting a bursary for that return of service. And so that's a huge boost to the rural remote communities. We've got nurse practitioners. We've seen roughly about a 80% increase in nurse practitioners in the province. And we now have roughly about 100 nurse practitioners that are actually taking patients, have their own panel of patients, which is helping to lower the number of people in the province that do not have a family practitioner. So I envision hopefully very soon that we will have everyone attached to a primary care home. So lots of great things happening. I could talk all the whole time period we're here just on the great things that we're seeing. Also lowering the number of ALC patients, which are alternative level of care patients that we have in our hospitals. So these are patients who have had their treatment, pardon me, but they get stuck in hospital. And why are they stuck there? When I first became the Minister of Health in 2023, June of 2023, Alberta Health Services told us we had roughly about 560 alternative level of care patients. As we dug deeper, we actually found we have closer to 1,600 of these patients. At the Royal Alex alone, as we dug even deeper, we had 7 patients that have lived in our hospitals for a combined 18 years, one who's been there over 5 years. We need to make sure our hospitals are serving hospital patients and those that need alternative living arrangements, that we find the proper living arrangement for them. So that's what we're doing.
Okay,
lots of great work happening.
I mean, you're rattling off the list, and that's good. And I know that Albertans will still have a ton of concerns around healthcare. As I know, I don't have to tell you that when there's inefficiencies or shortcomings in a healthcare system, it hits people where it hurts the most. On this dual delivery model, I want to dig into this. You've said that the goal is to improve access, but critics are warning that it'll create a 2-tier system. Anytime you invoke the word private in healthcare, it's going to raise that red flag. So I'm curious to know how you see that working and how you can guarantee Albertans without the financial means that it won't be limiting their access or mean longer wait times for healthcare services.
Well, first of all, people who have the means are actually leaving the province and going to other provinces and to other countries to get services done. And that is one of the things that I heard consistently. I don't think there is a person in Alberta who does not know someone who has left Alberta to go to another province, to another country, to get an elective surgery that they've been waiting for. What we have seen in other countries that also have strong universal public health care, that they have also been able to integrate a private or nonprofit system, parallel system, and that is what dual practice enables. Dual practice already exists within our province. You're either fully opted in as a physician or you're fully opted out, but it usually takes about 18 months for that to happen in our current system. With the dual practice, you will now have the option to be a flexibly participating physician on a case-by-case basis, basically being able to toggle between the private and the public, which allows more flexibility within the system. Those countries, and we actually have other provinces like Quebec and New Brunswick that have dual practice already existing. Those countries that do have the dual practice have seen their wait times come down, They have higher patient satisfaction, as well as they are just, able to deal with the backlogs much more efficiently and effectively than we are. I constantly heard and still hear from physicians, orthopedic surgeons who only get 1 or 2 days a month to operate, and they have huge backlogs on their wait lists. How do we deal with that if we are not able to provide more than what we're currently providing?
Yeah, I was talking to a physician who works in orthopedics literally yesterday, and he was talking to me about this. I mean, there's that, everybody knows about the Alberta Surgical Group, that ASG facility just north of the airport. And he was talking about how there's surgeons that are able to move back and forth between the two systems. But he was noting that it's quite a bit more, it's quite a bit more lucrative. The pay is better. The situation is better for doctors that are working in the private system. And he was questioning what would keep doctors or physicians or surgeons loyal to the public system if they can make more in the private system, whether or not they have the option of moving back and forth. How will you guarantee that you keep top talent and that you keep adequate staffing numbers in the public system?
Well, you put the right guardrails in place. You make sure that those guardrails are sufficient enough to ensure and incentivize the work that has to happen within the public system, whether we put a percentage number that physicians who are going to be flexibly participating and able to access work, doing work in the private system, that they would have to spend, say, and I'll pick a number, this is not the number. We're still going to work that out with the Alberta Medical Association, as well as a lot of our other College of Physicians and Surgeons and other stakeholders. But say 80% of the time has to be in the public system, and the other 20% perhaps you can do in the private system, or that you can only do in the private system on off hours, which is evenings and weekends. And again, there's lots of opportunities. I hear from orthopedic surgeons and other surgeons that are doing elective surgeries that they could do more, but they don't have access to OR time, or they, often would like to do more of those elective surgeries to clear the backlogs. But in the current system within Alberta Health Services, it takes a long time to go from one operating room to the next to do the changeover, where in some of the chartered surgical facilities, because of the efficiencies that they've found, they can change over the rooms very quickly. And there's also much higher patient satisfaction. The patients are much more satisfied.
Okay, that kind of ties into my next question. It's actually Goramut's question. They're in our live chat right now, powered by Park Power, wondering about transparency and reporting and tracking. Will your government be providing transparent data or modeling that'll show the dual delivery system at certain mile marker points that'll prove that it's either costing taxpayers less, that it's more efficient, or that it's cutting down on wait times? What's the commitment to transparency?
A strong commitment to transparency. In fact, the work that's being done by Minister Jones to make sure that we go to activity-based funding so that people know what the actual costs are is going to be out there as soon as we get all of that background work done. This will align very well with that. We are going to make sure that we'll have websites up so that people can actually see what those costs are. Right now, I have no way as the Minister of Health to look at what is being done in the private sector. We know that we have 14 physicians providing private surgeries here in Alberta, doing private work, but I have no access to that information. Under the new legislation, everyone will have to provide information, whether you are a participating, a non-participating, or a flexibly participating. You have to keep separate records, and they have to be brought into, they have to be shared with my ministry so that we can track that, and we will be sharing that with Albertans. I believe Albertans deserve to know what it actually costs to have a surgery or any procedure done. I'm old enough to remember when we had healthcare premiums where we would get a statement to say, this is what you've paid, but these are all the services that you received, and this is what it cost. I think we've lost that over time. People don't understand the costs that are associated with surgeries and other procedures and the high cost of medications, et cetera. And I think it's time we start to inform Albertans as to what the actual costs are.
Minister, a bit of a surprise announcement at the Alberta legislature, less than 24 hours ago, that AHS has canceled negotiations with companies tied to Sam Maraish, right at the center of Alberta's health procurement strategy, citing conflict conflicts of interest and procurement problems. This for proposed surgical clinics in your hometown of Red Deer. Given your government's push to expand private surgical delivery, how can Albertans trust the integrity of the process when deals are falling apart over conflict concerns? What's your message to Albertans?
Well, I would say that the new way we're doing things is actually working, that we are taking a very close look at what was done in the past. I know when I first became the minister in 2023, these contracts that had been RFP'd out in 2020 we're still, or 2021, we're still outstanding. And so now we need to make sure that they are very transparent. I had concerns with AHS procurement right from the beginning. It just didn't, some of the things just didn't make sense. People applied for RFPs and it was years before they actually were acted upon. Oftentimes the climate that people were in terms of financial, inflation went up, and yet they were tied to numbers that they had put forward years before in their RFP. So this new procurement, it actually aligns with all of the recommendations that were brought forward by Judge Wyatt. And we're looking at the Auditor General report as well. We want to make sure that we have a strong procurement process that is above reproach. And so that is what we're doing. And I believe it will work. It's already working, because having looked at those contracts, we needed to go back to the drawing board on them.
Yeah, when you had sniffed that out, had you raised those concerns with the Premier? Like, did you raise those concerns in Cabinet? Because I think people are given the impression that former Minister Guthrie was the only one that raised concerns, and he kind of paid for it with his job. Is that inaccurate?
Well, I always raise concerns, and in fact, it's the reason why when the former CEO that has put forward the lawsuit, that when she was in her position, when she said, "I think there's a problem here," I said, "Go digging, dig deeper, but keep me informed as to what's going on." And so that has always been my approach. If there's something wrong, let's figure it out and let's fix it.
But that doesn't track with the public's understanding. We're talking about Athana Menslopoulos, the former Alberta Health Services CEO. I think the public's impression and reporting around it is that when she raised concerns about procurement and said that she was digging into it, that she was fired. That seems to be the public's impression of the entire premise of her lawsuit, of her wrongful termination suit.
Well, I would tell them to go and look at all of the documentation, my statement that was provided, because it actually shares my version. And while I can't speak to things that are before the courts, I can just say that I have always been very concerned on, on procurement and contracts that do not follow the policies that were in place. And Alberta Health Services did not follow their own policies in a number of things that I saw as the Minister of Health that were brought before me.
Okay. Minister, back to the dual delivery system. Are you seeing this as a pilot in a sense? Like, if the experiment fails, or let's say that inequity worsens, what's the government's contingency plan? Like, would you be willing to freeze or reverse private expansion if the metrics show that it's moving in the wrong direction?
Well, we've seen by numerous countries, this is very much aligned to what is going on in Europe. And we have seen in those countries that, in fact, wait times have come down. People are getting their surgeries in clinically approved times, and that they are much happier with the work that's being provided and the care that they're getting. I don't see why this shouldn't work, but that being said, we're going to monitor it very closely. It is the reason why in Bill 11, we have given ourselves lots of levers that we can pull to make sure that if we have a shortage in a particular discipline, and I'll just pick one just as an example, such as anesthesia, that we would make sure that those individuals would not be able to be flexibly participating for a time period, or for a duration of time, so that we can make sure that we have a very strong public system. I've already said that we're going to adhere to our public health guarantee, that no Albertan will have to pay out of pocket to see their family doctor or for much needed surgery. But we also want to make sure that cancer care is, a top priority. We want to make sure that those emergency surgeries are done and are a top priority. And family physicians will not be allowed to be flexibly participating at this point in time. So there's a lot of guardrails and safeguards we can put in place. Some are already within the legislation. The levers are within the legislation, the framework that we have put forward. And then in regulation, we're going to fine tune that.
Right. Just so I don't miss anything. So it's family doctors that cannot flexibly participate, and oncology, like cancer surgeries. Is that right? Are those what's in
cancer surgeries, and also emergency surgeries and required surgeries?
Okay. So these are all elective
really
surgeries,
required,
basically.
Yeah.
Okay. Are you considering other options? Like, I mean, we live right by the Royal Alexandra Hospital. I always kind of use that as my benchmark of what wait times look like and the like in my own personal life. Would you consider things like keeping the Royal Alex ORs open on weekends or after hours to address things like surgical backlogs? My understanding is that there's available surgeons. I mean, you said as much, right? If they're available to go work at ASG, for example, private surgeries, would you keep ORs open after hours to address that backlog too?
We're looking at all our options. Minister Jones just announced that he's adding an additional funding for an additional 50,000 surgeries to help clear the backlogs. When I first started, we were doing roughly about 40 to 45% of surgeries in clinically approved times. We're now closer to 70% in clinically approved times. We've gone from roughly about 285,000 surgeries pre-pandemic. We're now at 300. We targeted 310,000 last year. We're now at 318,000. We're constrained by budget, and that's why some of these additional options to have additional private options for those individuals that are leaving the country or leaving the province that perhaps will actually add additional capacity. We know it will. So, we're looking at adding more through the Alberta Surgical Initiative. We're actually opening ORs that have been shelled in or, not working to their best capacity or efficiency across the province, sometimes in our rural remote locations. So we are seeing orthopedic surgeries being done in places like Rocky Mountain House. We're seeing cataract surgeries and eye surgeries being done in Innisfail, and that is expanding across the province. So it's not an either or, it's an and. Let's look at using all of our facilities to the maximum that we can, not overburdening our staff. And as I said earlier, we are seeing more doctors, and the doctors that are coming to Alberta are not just family physicians, they're also surgeons and specialists.
Yeah, do you see this?
That's a good thing.
Yeah, I mean, do you see this like and I've got no problem with people making money, and I know that every province, I mean, it's competitive, isn't it, to compete for nurses and doctors and surgeons and the top talent. Mm-hmm. And I think Albertans expect the top talent in the province. Is this in so many ways as it's you hope that it's an efficiency tool, you hope it cuts on wait times and improves access. Is it also a recruitment tool or a retention tool for doctors, surgeons, nurses?
Absolutely, because it gives you more options. It gives you more options for doctors that currently in rural locations. I've heard from I've been across the province talking to a lot of people on the front lines, and some of the doctors are saying, I would stay in this rural community, but I'm also, have the capacity to do surgery, and I'm not able to do it here because we're not allowing for that to happen within, say, Slave Lake was the one location where I remember hearing that most recently. So how do we allow for that to happen? Utilize those ORs that are out in these rural communities and do those elective surgeries that are less complex than, and keep our hospitals for those really complex surgeries. And I know people will say, well, then they get all the hard stuff, but that's not the case. What I hear from doctors as well is, yes, they want to do the hard stuff. They want to do the complex surgeries, but they can't do complex surgeries all the time. They'd like to also be able to do some of those elective surgeries.
Sure.
And when they have that option, they'll take that option. And nurses as well.
Sure.
They're happy to do both.
Okay, Minister, I appreciate your time. We've got time just for one more. I want to ask you almost an unrelated matter here, but Alberta's Privacy Commissioner just a short time ago has warned that putting personal health numbers, Alberta health numbers, on driver's licenses massively increases the risk of fraud and could lead to incorrect medical records. They say if the numbers are stolen. She also notes that the Registrar of Motor Vehicles is not subject to Alberta's privacy laws. Will your government continue to push ahead with this change despite the red flags that the Privacy Commissioner has identified?
Well, I really appreciate the Privacy Commissioner. She also highlighted some very good things that we're bringing forward in Bill 11. In terms of the privacy issues, we are taking her advice and making sure that we have the most stringent guidelines. We're actually updating, Minister Nally in his ministry is updating the security and the technology behind the driver's licenses. We will make sure that we have those safeguards in place for that. But I just have to remind Albertans right now, we are one of the last provinces with paper healthcare cards with no expiry date on it, with no picture on it. And we have roughly about 5 million people living in the province, but we have actually 5.5 million healthcare numbers that are active in the province. So if we're concerned about fraud, I'm very concerned about the fraud that is existing with our paper card right now. Oh, I can't hear you.
Sir, there we are. Hot. Do you have reason to believe that there is fraud occurring with Alberta Health? Do you have reason to believe that people are using healthcare numbers fraudulently to receive services?
Yeah.
You've seen evidence of it?
Because we have 5.5 million active cards, but we only have 5 million people living in the province. So yes, there is no expiry date on them. I've anecdotally heard some stories of people living in other countries that have kept their healthcare number and fly back to Alberta to get healthcare. So yes, I have heard that anecdotally.
So what would be this? I'm taking you a little bit into overtime. I thank you for that. If you have to go, just let me know. But just in follow-up, I have to ask a follow-up question here. What would you consider? I mean, are you considering reissuing all new healthcare numbers to sort of flush it and reboot the system, so to speak?
Well, the cost to that is astronomical, and that's why we want to do it thoughtfully through the process of renewing. And again, this will be voluntary to put it on your driver's license. You can still have a card, but it will have an expiry date on it. And there will be a process to get if you want to have just a plastic card, it will be a durable card. There's also the option that we did bring out earlier this year that is a digital version as well, and that will also have an expiry date. But to do it in one great flush, it is an astronomical number. But
wow, so
this is where we're going towards. We're going towards something that is more modern. Every other province, pretty well every other province in the country already has expiry dates on their healthcare cards, probably for the very same reason. It kind of shocks me that we're one of the last ones to do it.
It's just hitting me right now. I'm shocked mid-interview. I will agree with you that it's been sort of a bit of a bush league setup with these flimsy paper cards, and the only time anyone had a laminated card was if they did so on their own initiative. Did you have any insight into why there weren't expiry numbers in the first? I mean, it's obviously not this UCP government that did it. It's been that way for a long time. But did you have any insight into why?
No, other than there has been many attempts to go to a more durable card. And I think part of it was the expense. Part of it is timing. Political will. I'm not really sure. As a mother of 7 who had to carry around 7 paper cards, as well as my own, it was mind-boggling to me why that had to be the way it has to be. But I think right now common sense prevails, and I'm hoping that we can. I know we will get this over the finish line. Albertans want this, and it's long overdue.
All right, Minister. Thanks for taking the extra questions. We appreciate your time.
My pleasure. Thanks so much.
You got it. That's you as well. That's the Honorable Adriana LaGrange, Minister of Primary and Preventative Health Services. 5.5 million active healthcare numbers or healthcare cards in the province, which exceeds the population of Alberta. I see some of you immediately pouncing on the idea that it's, I'll use sort of the lazy language. It's undocumented immigrants, or it's undocumented workers, or it's temporary. That's not what she said. Keep in mind right away, she said that she had reason to believe. I got to go back and we call it air checking. I got to go back and listen to that again and hear the exact wording she said. But she basically said, Johnny, she said that they had reason to believe, or that they have seen evidence that people that have left Alberta are keeping their health care cards and then coming back to use Alberta Health Services, which is not undocumented immigrants, by the way, guys. I know that that's immediately where the conversation is going to go here, and people are going to start piling on undocumented immigrants. That's kind of like the Trumpian way, but that's regardless something that needs to be addressed. Whether or not it's the numbers on driver's licenses, the Privacy Commissioner's warning, I think, is one that should be heeded. If the Registrar of Motor Vehicles, by the way, did you know that the Registrar of Motor Vehicles was not subject to Alberta's privacy laws? That was also something. Yeah, I learned that yesterday. Seems kind of strange. There's a lot of personal information that the Registry of Motor Vehicles would have on someone, right? Mm-hmm. I don't care if everybody knows my weight on my driver's license, because that was my weight when I first got my driver's license.
Speak for yourself.
My driver's license suggests that I am a svelte 176 pounds.
Yeah, and I've grown 3 inches in height too.
But like even things like name and address.
Of course,
I don't want some lunatic being able to track down my address.
No,
but
not at all.
Kind of. But like, what is the solution? People are moving to more digital wallets. You remember back in the day?
Yeah, I've got my Alberta. I don't know if anyone uses the Alberta wallet system, but there's not very much in there right now. But I have it, and I would love for that to happen more. I would love to. I know it goes into a world where when your ID is in a digital form on a phone, it leads to can people Photoshop it and show fakes and stuff like that. But I mean, there's barcodes, there's QR codes, things that could alleviate that. How do you feel about it?
Well, I knew the whole, you remember we had these wonderful sponsors on the show back in the day. We still have a great relationship with them. We Know Training, this company that was doing kind of the, basically the digital wallets, the digital IDs. And this is where, as LaGrange, Minister LaGrange there is talking to us about modernizing the healthcare system, and we've got a ton of feedback, obviously, on this interview. Mm-hmm. Some of it I can actually even read on the show, but a lot of this is around modernizing the healthcare system, and of course you want that. You want your system to be modern in the sense of innovative delivery. We're talking about equipment in the ORs. We're talking about how triage happens. We're talking about the training that the healthcare professionals receive. We're talking about how records are kept and documented. I mean, everything across the board. I don't need to name everything that goes into a healthcare system. So to have paper cards or to have no cards at all, I just know my healthcare number off the top of my head.
So do I. I have my
healthcare,
SIN number and everything.
And driver's license.
Yeah.
Those are kind of the 3 numbers I can, and my wife's phone number. Those
but
are
I have
4 I can remember.
Yeah, but I'll show you. I have the app right here. I don't know if people can see, but
just show us your QR code there on
no,
the screen,
but,
John.
Look, I'm not even logged in, but that's called the Alberta Wallet. And so eventually, I think the government thinks right now, I think it's just in terms of healthcare in there, but it seems like a way to possibly in the future have your driver's license and anything else relating to the province in there, which I think is great. But it does give way to who has access to this information. Can it be hacked and stuff like that? But I'm sure if it's all online anyways in some sort of cloud and some sort of database, it's still open to that as well.
Sure. I've here's this is anecdotal evidence, but evidence nonetheless. In our live chat powered by Park Power, your friendly local utilities provider, Tracy says, in 26 years of work, I have helped 6 people with multiple cards. She says these are health department mistakes. Brenna is watching us. What's up, Brenna? Says, my father was issued a healthcare number in the 1950s. He left Alberta for 40 years, and when he came back, he received a new healthcare number. She goes, could that be part of the unexplained volume of cards? Of course it could. Dubious, meantime, says, come to Alberta for healthcare for what? People are driving to BC to get COVID shots. Are people really driving to BC to get COVID shots? I mean, really? I understand a lot of people push back. I don't think it's a good call that Alberta's making people pay for their COVID shots. I think that that's more ideological than a fiscal issue. That's my personal opinion on it. But if you're driving to BC to get a COVID shot, how much am I missing the point, Dubious? How much are you spending on gas
exactly.
to go get a free COVID shot?
The driving though, or leaving Alberta and coming back. I want to. That was interesting. We need to get someone else on here to tell us more in depth on what that is, because I have an OHIP number, right?
What's that, Ontario?
Yeah, Ontario, because I grew up there, right? So,
Yeah.
but like your health number in a province never disappears. Like if you don't use it, if you leave Ontario or Alberta, it never goes away. So if I went home for, say, the holidays or, Thanksgiving or whatever, and I got sick, I'd still be able to go there and use the OHIP number. That kind of makes sense to me. But people leaving Alberta to live somewhere else and then coming back, I don't see the reasoning for that. So that was really interesting. I think we should get someone else in to talk about exactly why that's happening.
Yeah. Interesting point from Jillian. We know Jillian is one of our regular commentators, has lived in Quebec and Alberta. She says, guys, you don't lose healthcare coverage if you're away from the province only part-time. She says, so I'm sure that many Alberta snowbirds or even BC residents are still using their cards. Yeah, fair enough. Let us know what you think about this. Sandy says, I'm a realtor. She says, I can use, what do you say, Johnny? OHIP? Says I can use an Ontario healthcare card to FinTrack somebody. Says it has a picture, a birth date, and an expiry date, as well as a number. And Sandy, it sounds to me like you're saying that's a positive, right? Yeah, how do healthcare cards not have photos on? I mean, I guess everything we're talking about, though, too, we lose our... As civilians, and we got two politicians coming in here in just a second. Maybe they can take some of these questions as well. They've been inside that government. They're outside now as independents. But we have ideas like, why don't you just reissue all these healthcare cards, with QR codes and bring them up to 2025 or make them, future proof with photos and everything else. But that's probably like $60 million to do that for 5 million people. I don't know.
I don't know. The photos is kind of like, do we put, I remember we had those guests on talking about gender on certain cards and stuff like that. I feel like health is like open to everybody. I don't think you need a photo, but like definitely upgrading the whole way the way the card is laid out. Like my card, I don't know, I haven't updated in a while, but it's like a piece of paper laminated. It's not a very, it's definitely not something with like a hologram on it or ways to tell if it's been counterfeited like a driver's license. So it would be good to have an upgrade to the whole card system.
Sure. Cassandra says, I've got a copy of my mom's BC health card. It absolutely does not have an expiry date on it. It's exactly like a credit card, she says. Cliff says there's nothing wrong with requiring people to renew their healthcare cards. It's called being a responsible adult, same as renewing your driver's license at the registry or anything similar to that.
But if it's permanent, it'd be like if they asked everyone to renew like their birth, I don't know. But I do agree it needs to be upgraded to if there's a problem with people trying to steal healthcare, which I don't think there is.
I don't know if that's a rampant issue. Super Chat Ken here says, and Ken's absolutely not wrong, says Alberta, more than any other province in Canada, has had more immigration of workers that would take a healthcare number with them. Says it's not evidence of fraud. He says the UCP has shown no other evidence. I think what Ken is alluding to is that we can blame Newfoundland for all of this.
Damn you, no, I won't say it. You can't even say Newfies.
No,
anymore.
I don't know. That's kind of like
people in my family from Newfoundland. I'm allowed.
Newfie is like the soft slur. It's like the softest of slurs, but I don't think they prefer it. And if you say it to a Newfoundlander's face, you might get a beer thrown in your face at best, and you might get punched.
Well, I was going to say they might just put a beer in your mouth. They're so nice. They'd probably be like, hey, listen, that's not how we say that. They
got to be some of the nicest people on planet Earth, to be honest with you.
But yeah, what did you last thing here before we go to our next guest, what did you think of some of the numbers of the improvements she was?
Yeah, well, I mean, we've got a surgeon who's watching us right now who I'm not going to name them because, just for obvious reasons, for professional blowback, but says the minister talked about the many ALC patients, says, we need examples when it comes to long-term care. Many are still waiting, and says at a recent meeting with AHS, the overall messaging was, we hear you and we're building new spaces. Says regarding nurse practitioners, there may be more, but they're still few and far between. And says there's also a lot of nurse practitioners that are working in things like hormone clinics. So when the minister's talking about this increase in staffing, the increase in numbers, the influx in talent, says, there's a lot of people, or, these nurse practitioners working in hormone clinics basically ordering unnecessary tests for my patients, for other female patients, and then basically just selling them hormones. Says there are major surgery backlogs, and efficiencies are not a patented product. says if things are more efficient in other jurisdictions, then just copy that model. This surgeon says, keep in mind that elective surgeries are still medically needed surgeries. Like, we're not just talking about like breast enhancements here, right? They're still, that was my take, by the way, not the surgeons. Medically needed surgeries. They are not surgeries that are not needed. And this surgeon points out the number of surgeries that are being done at private clinics like ASG, just south of Edmonton, just north of the airport, in that pandemic period were huge compared to the surgeries that were done at the Royal Alex. Says this is unfairly padding the stats, so to speak, because most of these were very much needed hip and knee surgeries.
During
right?
the pandemic.
Like, you know, when you talk about like hip and knee surgeries, if you need them, you need them.
You're in pain every day.
You're absolutely crippled and facing debilitating pain without these. We better pay a couple of bills, and we've got a couple of guests in our green room right now ready to go. I referenced Pete Guthrie in my interview with Minister LaGrange. He was formerly the infrastructure minister under Premier Danielle Smith, and then was ousted from cabinet, then the party. So was, or rather the caucus, I should say, so is Scott Sinclair, the MLA out of Lesser Slave Lake, who refused to vote for the budget that he said didn't do enough for his riding. Well, they're trying to restart the PC party, and well, the UCP doesn't love it. So we're going to get that story coming up in just a second. First, I want to let you know that these conversations would not happen without incredible Real Talk partners like the team at Kubi Renewable Energy. And I know right now with a couple more fresh centimeters of snow, depending on where you woke up, it might have been 10 centimeters right now. You're probably not thinking about solar, but there's this common misconception right now that solar doesn't produce much power in the winter, but the truth could actually surprise you. Even with shorter days, your solar system still generates energy. In fact, cold temperatures can actually help your panels perform more efficiently. So thanks to net billing in Alberta, or if you're listening to us in BC, you've got self-generation there. Kubi installs in both provinces. Homeowners can bank excess power generated during the sunny summer months, and then you can use those credits to offset energy use in the winter. That means your system works year-round to reduce your electricity costs, and you can enjoy your energy savings no matter the season. If you're curious to learn how solar performs in Canada's colder months, check out their blog post on their website, Solar Panels in Winter. That's also where you can get a free solar quote 12 months a year, Kubi.ca. That's KUBY.ca. Friends at Friesen Brothers celebrating 70 years this year, which is absolutely incredible. This is a legendary Alberta-grown, Alberta-owned success story. And they've got their signature Christmas meals, their vegan Christmas dinner boxes, a ton of options for those of you that are looking to make the most of your holiday socializing and spend less time in the kitchen. You can order all you need. The signature Christmas meal is what our family's gone for. Absolutely spectacular stuff, including roasted turkey, scalloped potatoes, creamy dill carrots. Those will blow your mind. Granny's stuffing, a Caesar salad, tray buns, cranberry sauce, turkey gravy, and apple crumble pie. A stress-free holiday meal for 6 people for just $2.29. You can order ahead of time at cateringbyfriesen.com. Pick up in Edmonton, Glenora, Edmonton, Rabbit Hill, Fort Saskatchewan, and Stony Plain. Find out more at cateringbyfriesen.com. California Closets, making dreams come true year-round for folks that are looking for the dream custom closet or a storage solution that really works for their entire home. I'm going to recommend, if your spouse, if your life partner, if the most important person in your life is impossible to buy for, and you know that a custom closet or maybe a custom garage would absolutely blow their mind, this is a perfect Christmas gift. Why not gift them the consultation? It's free. And then the two of you can go hang out with a California Closets designer, talk about the space, talk about the budget, and design your dream space together. It's a unique Christmas gift. It's guaranteed for life, and it's manufactured right here in Alberta by this Canadian-owned company. You can request that free consultation today at californiaclosets.ca. And as we're talking about healthcare and hospitals, we must remind you that the Royal Alexandra Hospital Foundation right now is looking to raise $10 million to support the Bridge Healing Program. This is the human way forward. It's housing as healthcare. If you checked out our November 28th Real Talk Roundtable, you've already heard Dr. Louis Francis Cuddy talk about the value of housing to get the unhoused population back on their feet and on the road to recovery. It's incredibly important. You can learn more about it at royalalex.org. We're A day past Giving Tuesday, but that doesn't mean the giving has to stop. You can consider a donation today at royalalex.org/bridgehealing. As we welcome the MLA out of Airdrie Cochrane, Peter Guthrie, the MLA out of Lesser Slave Lake, Scott Sinclair to the program. Fellas, thank you for making time for us today. Welcome back to the Real Talk studio. It's nice to see you.
Yeah, good to be here.
Yeah, I was referencing you, not by name, but alluding to you in my conversation with Health Minister Adriana LaGrange just a few minutes ago.
Okay.
You were Alberta. I know you were getting a coffee in that moment. You go, okay. You were Infrastructure Minister at the time when you've told the story. You say, and I'll let you tell the story in your own words, that you sniffed out something that was concerning you about procurement in the province. She just told us on the show, she says she had the same concerns around procurement and raised them. She says she told the former AHS CEO to go after it, to sniff it out. I challenged her on that, said that's not, I don't think, what the public perception is, but you would have been in the room. You would have been around the cabinet table at the time. What's your recollection of that?
That's surprising to me. I did not hear that that part of the interview. Yeah, certainly that's not the case and not my understanding. There is a court case, right now with Athana Menthalopoulos, the former CEO. She's going to be presenting evidence on this, and I think it's everything to the contrary. In fact, I think in late, 2024, Adriana had issued an order in council to shut down the investigation into the surgical contracts as well as Tylenol. So that's quite contrary to everything that I've heard and learned along the way.
Okay. I wanted to ask, both of you did have a chance to hear the majority of the interview. Scott, welcome back to the show. It's nice to have you around the table today. What jumped out? You guys have experience, obviously, in government, elected officials. You're still MLAs. Was I correct, by the way, in introducing you as independent MLAs right now? Because there seems to be some obfuscation around exactly who you're representing in the legislature.
Yeah, I think officially we are still independent MLAs inside of the legislature, but we are in the middle of, since July, and we announced even on this show, and you got to announce the scoop there that we're planning on rebooting the PC movement. And since then, former Minister Guthrie and I have been embattled with the UCP on the name change, and we're right in the middle of it now. But the one thing we're more confident than ever, especially with what's happening recently with the UCP and the government, that we're on the right track, and we've really woken a sleeping giant of people that, and we've mentioned this before, don't feel like they have a political home in this province. That part is 100% true. The name change and the details of the lawsuit, I think we can speak on that a little bit further after, if you'd like. But,
yeah, I definitely want to speak about it. It's taken me, I'm a little bit annoyed at you guys that it's taken me a while to get you in here, but I know that when people are being sued, probably your lawyer's first inclination is to tell you it should be your last inclination to go on a podcast and chat about it.
Well, yeah, somewhat buried in trying to figure out the response and the strategy and getting those legal opinions in order. Scott and I are a small team. We don't have the resources that the UCP has behind them. So we got to be a little bit more strategic in our thought and try not to jump out and get ahead until we really have a good understanding of where we are. But as far as legal footing, we feel we're in sound legal ground. We have all the way. We feel like we've followed every rule that's been set forth by Elections Alberta. And
Okay, well, before we get into this, let me ask you, because I don't want to take anything for granted. I don't want to make any assumptions. When you say, with everything going on right now, a lot of people are feeling politically homeless. What do you mean by that? There's a million things going on right now. What are the things that you think are causing people, particularly conservatives, to feel politically homeless?
Well, I think it's directly correlated to even our lawsuit. I mean, if the UCP thought they were on solid footing with their legal argument, our lawyers say it's frivolous and a slap suit designed to delay and intimidate us. Certainly, suing us personally, I think, adds another level to that, which just in itself is a pretty wild thing in politics, to be suing a political opponent who's opposing your view. And there's rumored legislation that's being tabled this week where now they're going to ban the word progressive from politics. So if you believed in the rule of law and the courts and Elections Alberta being an independent office, you wouldn't need to change the laws in order to confirm that. You would allow them to make their decision. So at every turn, it is our opinion that they've done this simply as a delay tactic to stop us from being able to fundraise and capitalize on that movement that we're talking about of, I think, a very quiet, polite majority in this province that maybe doesn't follow politics all the time, but come election time, I certainly think that we're going to be the only conservative option available. And the UCP and the Premier's step to the outside in order to appease her base, which it's not even working anymore, has put her in an impossible position. So Pete and I always speak about, what our movements looks like, and it's pretty broad stuff, but I think like fiscally responsible, socially reliable, and getting back to balancing budgets, value for money, core services, and the UCP has frayed completely away from that. And the troubling part for her at the AGM this weekend is the separatists now don't believe her when she's trying to walk this line and be two different people in two different rooms. So Jeffrey Rath is probably, I would say, the front runner or the de facto leader of the UCP now after this weekend. And, they're in trouble. The people that thought she was going to take this farther on the separation point are disappointed. And then there's a good chunk of the majority of Albertans who never wanted to have the conversation about separation. And I think you've had him on his show, but I think Thomas Lukaszik's Forever Canada campaign just completely confirms that people, although they're frustrated with Ottawa, they see a complete difference between the Donald Trump United States of America and where Alberta and Canada fits in. And I think there's lots of conservatives like Pete and I that are still proud to be Canadian at the end of the day.
Yeah, so I'll let the audience know, by the way, Thomas Lukaszik is going to join us on the show tomorrow on our Thursday episode. That'll be the 4th of December, just to talk about the fact that the Elections Alberta has officially verified his petition now, which kind of forces it, triggers a legislative process. I talked about this on CBC National yesterday with Andrew Nichols. The Premier's got to make a choice right now, right? I mean, she can put it to MLAs for a free vote, and they can put it to committee, which I would imagine they probably will do. I'll pick your brains on this. Put it to committee. The committee would have a set number of days to make a recommendation. The recommendation could include a referendum, which I'm eager to see. Thomas thinks it's a terrible idea. Most people I talk to think that it's a terrible idea, and I'll acknowledge that. I'm in the minority, but I want to see what the number is, and I want to sort of quiet the conversation for good, see what the scoreboard looks like at the end of the day. What do you expect is going to happen now that the petition has been officially verified earlier this week?
Well, regardless of what the wording is going to be, there's going to be an independence referendum. There's no question.
You guarantee it?
Well, I don't think the Premier has any choice. We saw what happened at the AGM. The separatists within the party, they've taken over. When the Premier got elected, she had her leadership, got elected. She had a resounding support level during her her AGM last year during her review. That pound of flesh that the independence movement is looking for is coming. And one of the things that's happening is Jeffrey Rath is going to be negotiating with the Premier, and what that independence referendum is going to look like and the timing of it, I think, is up for grabs right now. I'm hearing possibly in the spring, but like it or not, I think it's coming. For myself, I think that levels in this province are probably somewhere in the 20% level. The independence movement is saying it's 30, but if they're provided with enough time, if they had 6 months or so to be able to be out and promote, they think that they could be successful in getting this through.
Well, let me say that I think that greatly underestimates the resolve of the people that would fight on the flip side, and that includes me personally.
Yeah, me as well.
Yeah, I think you want more time, you're going to light a fire under people that are very passionate about Alberta being a part of Canada and passionate about Canada, period. I had a hilarious tweet aimed at me the other day. I said, Danielle Smith gets booed by separatists at the UCP AGM. This person jumps forward to clarify, we weren't booing the Premier, we were booing Canada. I said, okay, Patriot, let's see how that flies. That's unbelievable. These are the same people that rip on folks for not wearing poppies around Remembrance Day. Now they're booing Canada a month later. Give me a break.
Thomas Lukaszik getting 550,000 signatures in 90 days.
Verified now 438, but
still. That's an incredible feat. I thought it was near impossible for him to be able to go out, organize like that, and get that. I think it really speaks to the support that Canada has. We are stronger within Canada, no question.
Okay, we want to get into the live chat here. We have a ton of questions. I also know you have something you want to say, Scott, so I'll get to you. We're talking to MLAs Scott Sinclair and Peter Guthrie in our feature interview today, presented by Mercedes-Benz Edmonton West. Someone in our live chat says, hang on a second, progressive? Didn't these guys just vote yes on Bill 9? Can you explain your position on Bill 9? This is the controversial bill that obviously triggered use of the Notwithstanding clause, and I know that people will want to hear your position on it.
Yeah, I made my position clear on that. When a bill gets introduced in the House, you haven't seen the bill yet, and so that's what happened. We had no inside information as to what was contained inside of that bill. Not until they table it, we have an opportunity to read it, can we take a position. My position on second and third reading will be against the bill, but I voted yes to reading the bill.
Okay,
that's
so you
plain
don't
and simple.
support Bill 9. How do you feel about the use of the Notwithstanding clause twice in 3 weeks earlier this session?
Been speaking out considerably against the Notwithstanding clause used in this way. Before the courts have even ruled, that's not the purpose of the Notwithstanding clause. But please go ahead there, Scott.
I was just going to say that is the real concern I think that Albertans should have right now is the just like the lawsuit and many other things that this government's doing right now is the dangerous overreach for a premier who has rose to popularity under the guise of freedom. It's in practice, she's proven that it's only the freedoms or the things that she believes in. Rules for thee, not for me, I like to say. And that anytime you're introducing a law or the Notwithstanding clause and the usage of it, you have to imagine what that power looks like in the power of somebody you oppose politically. And that's one of the dangers in using it as, like, no pun intended, a trump card to be able to ram through any decision this premier wants to do. So it shouldn't be used on a weekly basis. It shouldn't be used to ram bills through, and it definitely shouldn't be used to preempt the court process. And I think that if people, conservatives, were watching a NDP or a Liberal government do this, they'd be storming at the gates, and we'd see significant pushback there. And I think that, when it comes to democracy and the rule of law, I think she's completely thrown it out the window, and we're in real dangerous territory by using it so frivolously.
Okay.
Confrontation versus negotiation. That's what you got from this current government. They've been successful in doing it thus far, but they've taken that approach with the public service, with teachers, with doctors, with nurses, with us firsthand. That's just their approach. However, it's not paying dividends for them now. Eventually, people start to fight back. Eventually, you just push and push and push. That Notwithstanding clause has really turned the tables, and it has put a fire underneath numerous peoples across this province, and you're seeing that in the recall.
So, go ahead, Scott.
I was just going to say something that's wild that I read an article about recently is even the teachers, labeling them as villains, using the Notwithstanding clause. A lot of that was, for me, wrong priorities by this government.
To be clear, no elected official called
no,
teachers
but I mean
villains.
the way they're perceived is vilifying them,
Sure.
and it's just a wild thing. I think there's lots of families and households in this province where you would see, a teacher, like in Slave Lake, where I'm from. I have one of my closest friends, his wife's a teacher, and he works in industry. And I think there's lots of households that are like that. And the article was referencing that the teachers movement was a large part of the old progressive conservative movement back in the day. They used to even go to the AGMs. So when we talk about this idea that the identifying villains all the time and then blaming them for everything, I think it's just the wrong approach. And people are starting to yearn for a government that tries to listen to people and find common ground, a steady, principled, boring government.
So help me understand here. I feel a little bit silly. I don't quite understand what's going on. So I know you want to revive the PC brand,
right,
the Progressive Conservative Party, but the Alberta Party is also kind of factoring into this, right? Like you guys have joined the Alberta Party, but neither of you you're not co-leaders of the Alberta Party. Are you trying to explain this to me? Are you trying?
Yeah.
You'll utilize their structure. Party structure is important,
yes,
and then you would rebrand the Alberta Party. to the Progressive Conservative Party? Is this the plan?
That's the plan. Yeah.
Okay.
It kind of like doing a reverse takeover so that you could have a trading symbol so you can trade on a stock market.
Okay, but neither of you are the
Taking a shell
leader of
company.
the Alberta Party right now, correct?
No, that's correct.
Okay,
we're
you're
both
just members.
independent members. We are working with the Alberta Party. I can tell you that a new board was elected just a couple of weeks ago. They had the first meeting last week, one last night. I think that you're going to start to see some activity.
Do you feel like you
Social
have
media-
unanimous support from Alberta Party members, or do some of them feel like this is a hostile takeover?
I mean, I don't think that getting unanimous support is that's a very difficult thing to say.
Sure.
But it's a very high percentage. We received 94% support on August 27th to do a name change, and I think that's a very high number. Sure, there was some that may be a little resistant initially, but the Alberta Party really didn't have a lot left.
I agree.
And didn't.
It pains me to agree.
Yes.
It pains me to agree.
Yeah, it really was just a small board that was just trying to keep things afloat. We received a cease and desist on July 14th, about 12 days after we were on your show.
Nice.
I think something like that. And
From the UCP or from
the,
lawyers?
Yeah, pardon me, from the UCP. And about a week or so after that, the Alberta Party said, hey, look, maybe we might have some synergies here. Why don't we start working together and look and see if we can transform our party and do a name change into that PC party that you guys have envisioned.
Okay, so I'll reference Joel Dryden's reporting with CBC News here. The party alleging is the UCP is suing the two of you, and suing you personally, by the way, as you noted, which is somewhat remarkable. The party's alleging a conspiracy to improperly use the name and trademarks to compete with the UCP is causing damage. And Vamp Fashions in our live chat says, well, hang on a second, though. Like that is the former name. Man, our live chat is humming today, so I lost the comment. Vamp, I'll try to do it justice, but Vamp Fashions basically says that is the legacy name of the UCP. You can't just swoop in and take it. The UCP is right to target the two of you. What would you say to Vamp?
Couple important points, if I may, is the name itself was registered by a citizen that both Pete and I didn't know prior to being removed from caucus, and they let the name lapse with corporate registries.
So it was up for grabs.
It was up for grabs.
Why didn't I get it?
Somebody should have got it and
Why
sold
didn't
it.
Huge mistake.
Why didn't the UCP
Why didn't the
pick that
UCP
up?
get it? So
Well,
they should be
good
suing
question.
themselves there for that point number one. The argument they're trying to make is on the trademark aspect of it, but Elections Alberta is a separate one. But what I would say on the trademark or the name part, that's really ridiculous, is sure the PC is the legacy name of the two parties, but they don't seem to have a problem with having two Wild Rose parties. Both, I think one of them, the Wild Rose Loyalty Coalition, and the other one's a Wild Rose Alliance. Independents. But allowed to be in an election. So the reason they're so fearful is because we're going to be really the only conservative option left at the ballot polls. Whether we get this name, and I hope we do, or a different one, we will continue offering a moderate conservative or a low-key conservative is what my daughters were saying, which I like, an option for people that's going to seem obvious and reasonable, given the alternative is basically two other separatist parties at this point. Jeffrey Rath said we are a separatist party about the UCP, 80% of us, and he's going to make sure that they put forward separatist MLAs and a separatist agenda. So there's the
That'll be
premier's
the
in
death of that party. I'll predict it today on December 3rd, 2025.
Yeah, so I don't really know what the path looks like because these...
What do you mean two separatist parties, though?
Well, I think the Alberta Republican Party pulled
I
okay.
see what you're saying. You're not calling Naheed Nenchi's NDP a separatist party. I guess I'm just showing disrespect. I may be showing some disrespect to the fledgling parties. Maybe they deserve a little more respect from me.
Yeah, that's fair. And I think when people come to the ballots, they're going to look at the path that the Premier's taken this government on, and it's nothing that we campaigned on, even when we were inside the UCP. And these are poison pills for policies when it comes to the unpopularity of them. The Alberta pension plan, separation, the police force, none of these, if we mentioned them or ran on them, would have allowed us to win. And then, the interesting part is balancing budgets, value for spending, protecting jobs. These are things that we win governments on, and none of that is mentioned at the AGM except for the pipeline. And I think everyone's seen the pipeline gets booed at a conservative AGM, which to me is a real wild, eye-opening experience for what the base of this party is now.
To the root of your caller's question, though, when you bring two companies together, you will have an official merger that takes place, correct? Now, that did not happen with the UCP and the Wild Rose. They basically started a new organization. They wanted to move quickly. So these are not two corporations that came together. They're basically two businesses that fell apart and kind of came together in a new unit. So they don't own that previous Intel trademark, et cetera. Now, where the trademark is concerned, that's an interesting one. That trademark, the PC Alberta trademark, hasn't been used in 8 years. You have to do filings every year. The UCP has not been doing those.
Since Jason Kenney and Brian Jean merged the parties.
That's correct. And in fact, we filed for an expungement of that trademark. So they don't have a leg to stand on. That's why they're taking us to court, doing what they can. This is a slap suit. It's a 5-page document that doesn't have much substance to it.
You don't sound too concerned.
Well, I don't like being sued. But,
Weird.
Yeah, but at the same time, I think December 10th, I think, is the date that we have to respond. And I think you're going to see a strong response from Scott and I and the Alberta Party.
What would that look like?
Well, another accusation that they made in there is that Scott and I were dismissed for misconduct. And I think we're going to deal with that portion.
That sounds to me like you're going to sue for defamation. Am I onto something? Your lawyer's saying don't say a damn thing right now.
Ryan, if I might give a clear answer, I think to your caller's question is, if the UCP was confident in their argument legally here, why are they going to, and this is just rumor, they haven't tabled yet, why are they tabling legislation to make it law to ban the word progressive? Because if you thought you had a solid legal argument, you would just allow this process to play out. You would allow Elections Alberta, who is the authority on these decisions, to make their decision, and then they would allow the legal case to play out. But it just shows that they don't have a leg to stand on legally here, and they're doing this to muzzle opposing MLAs and to damage us and intimidate us personally by suing us and delaying us from fundraising and getting the party going. There's a lot of people excited right now.
They have no choice. I mean, really, if you consider it, the polling there's been some internal polling that's been done. There's one public poll that's been done, and the UCP is all about polling. So they would have done some polling as to what it looks like with a hypothetical PC party. They would have seen the same thing that we're seeing, 29-30% support for bringing back the PC party. It relegates the UCP to third place. The numbers that we've seen have ranged anywhere from about 18 to 23% support for the UCP. They know full well they have to give everything they have against us to stop us, and that's why they're not touching the Wild Rose.
Yeah, so I mean, that basically makes the assumption, if you say that it would relegate them to third place, it makes the assumption that voters and supporters will feel two things. Number one, a loyalty to the older revived brand. Number two, that they have trust or faith in either the people that are reviving the brand or in the validity of it. In other words, that it'll have punch power, right?
It's going to be interesting to see now what the polling is going to show, because it's after this AGM, it is clear this is a separatist party. So you now have a government that is the membership, at least, it fully supports independence. So
well, yeah, okay. Let me, and it's kind of funny here because I know that some people will write in and say I'm carrying water for the UCP on this, but I will point out a couple of things.
Sure.
And I'll say this as I'll put the ball into play here, and you guys can respond to it. You had Jeffrey Rath. For people that don't know, he's been on the show a couple of times. You can check out our interview with Jeff Rath. Just search Jeff Rath Real Talk, and you'll find that interview talking about his goal of separating Alberta from Canada, this Alberta sovereignty movement. They call it the Alberta Prosperity Project. So he stood up. I think most people have seen the clip, at least people that are as into politics as we are. People have seen the clip where he stands up at the UCP AGM in Edmonton just this past weekend, and he basically says, who here supports, what did he say, a sovereign and free Alberta, something like that.
Yes.
And the place did erupt.
It did.
The place did erupt. Now, on the flip side, you've got the premier, who's also the leader of the UCP, of course, Danielle Smith, and she says along the lines of, my paraphrase, hey, listen, we may disagree on this. She says, but she thinks that, and look at, she just signed an MOU with the prime minister. She's obviously sort of hobnobbing and working with a liberal prime minister. Danielle Smith has stated plainly, and I'm not going to say that senior members of her advisory team and folks within her office all feel the same way, because I guarantee they don't, but she personally has gone on the record, including on this show, saying that she believes in a free Alberta within Canada. She's not a separatist herself, and I guarantee that not every UCP member is a separatist. So you can take a look at what happens at an AGM, which is one thing. These are the most hyper involved. These are the most passionate. These are the most driven, and oftentimes the most angry and motivated members that are showing up to this sort of thing. It's easy, maybe not easy, but it's doable to get 1,500 or 2,000 people to show up at something and make a lot of noise. It's a different thing to get 2.5 million people to vote for the province to shut the door on the rest of the country. Do we all acknowledge that?
Sure.
100%. Yep.
Okay.
Yep.
But
And
she
I
has
think
no
that-
choice but to take that position. I mean, she knows that that's where the general public is. However, this is where one gets themselves in trouble when, with certain groups, you will tell them certain things, but then publicly you're saying something different. When you are not consistent in your messaging, depending on the room, that is going to eventually get you into trouble. And I would say that actions speak louder than words. Take a look at the Alberta Next panel. This was a separatist panel. I mean, the issues that were on there were everything that the independence movement wants. And so that was the government saying, hey, this is where we want to end up. We want to have a referendum on these issues. How do we get there? Well, let's do an Alberta Next panel. Let's make sure that the rooms are full with our people so that we gain that support, so that when we come back, we can show Albertans that we have the backing to move ahead with these referenda. I'll pass it over to you. I know you were going to jump in there too.
Well, there's just a couple points that are important here, I think, is the premier's, I can't remember what the word salad is exactly. It sounds like that Pearl Jam song, Elderly Woman Behind the Counter of a Small Town, whenever
Nice
she
reference.
regurgitates her sovereign within a united, whatever that sentence is that nobody really believes anymore. I think, she has to do that. And she's trying to go into the one room and negotiate the pipeline deal. The big issue now is none of the separatists believe that she's going to take them there, or they're not going to let her fool them anymore. And this is the important part that for everybody listening is if there's leverage for threatening separation, that might help with Ottawa, which a lot of, I think, moderates even believe might be an okay tactic. But if you go to that referendum and it comes back 75-25 or 80-20 against, then Mark Carney's going to say, like, you have no leverage. Your whole province disagrees with you. And Rob Smith is the president of the UCP. He's been quoted, I believe, in an article yesterday or the day of the weekend of the AGM, saying something along the lines of, even if Pierre Poilievre won the federal election, we would still want independence in Alberta. And I'm paraphrasing a little bit there, but something along those lines. So getting rid of the carbon tax, having a new pipeline deal, all these things normally should be exciting for Conservatives, and they don't want that. It's still not good enough. So they're going to hold her feet to the fire. And then I'd imagine the moderates inside of the party are wondering, like, how are we going to win an election if we continue down this path where we're going farther and farther away? And if they got rid of her or they try and change out the premier, which could be a reality here soon, they're not going to accept a more moderate version of Danielle Smith. The party won't accept it. So this is a real impossible path for her to be able to tie these two worlds together.
Can I keep you guys for another 15 minutes?
Sure. We can talk pipeline if you want.
Yeah, of course we're going to talk pipeline.
Okay.
And your colleague here, MLA Sinclair, just casually dropped the idea that Danielle Smith could be usurped as leader and premier. So we'll have to revisit
Very
that
possible.
as well. We're talking to independent MLAs Scott Sinclair and Peter Guthrie in our feature interview presented by Mercedes-Benz Edmonton West. Our Real Talk live chat right now is absolutely smoking, powered by Park Power. And I want to get to that as well. We've got a ton of comments here. M. Aitken says, just watching the way that these two are treated by the speaker and the UCP in the legislature makes me want to support them fully. We'll get to that. MA, Ms. B says banning the word progressive from politics. That comes across as pretty desperate. Others of you are saying, Vamp Fashion says, listen, these two can organize and fundraise all they want. Just come up with your own name. Says it's like the background players trying to perform as the Guess Who. Nice Canadian reference. Super Chat Ken says, you can argue Jason Kenney was too fiscally conservative on the budgets. And I do, says Ken, for education specifically, but the spending under Danielle Smith has completely gone the other way. Peter says, I'm supportive of a centrist progressive party. They came into power, replacing over 4 decades of socially conservative social credit with a morality right-wing base, just like the UCP, which is kind of an interesting one as well. Hey, guys, fun fact about me. Did you know that my great uncle, Ralph Jesperson, was a former social credit MLA / dairy farmer? Unbelievable. I think that's where the roots of my political involvement came. Whenever we'd visit the farm, and great uncle Ralph would talk to me about what was happening or what did happen through his involvement under then Premier Ernest Manning at the Alberta legislature. Wild stuff. More of a deep dive here. Plus, we'll get into pipeline talk and more with Pete Guthrie and Scott Sinclair in our feature interview presented by Mercedes-Benz Edmonton West. It's Wednesday, and every Wednesday we're lucky enough to get out to the mountains, courtesy of our friends at Tourism Jasper. It's My Jasper Memories. And this week, we want to tell you about something that's happening, a new glacial plunge and sauna experience in Jasper National Park. Our friends at the Fairmont Jasper Park Lodge are redefining winter wellness with an immersive guided experience. This is set against the breathtaking shores of Lac Beauvert. Guests are invited to embrace Jasper's wild beauty and to discover, of course, the restorative power of thermal therapy, local aromatics, and centuries-old rituals in a setting that is as invigorating as it is serene. Expert guides will begin by leading you through grounding breath work, and they'll explore the philosophy behind the cold plunge. This is a ritual that's long been celebrated for sharpening your focus and revitalizing your body and your mind. Johnny's showing us some photos right now. If you're watching us on YouTube, that looks absolutely amazing. And then once you've done the cold plunge, aromatherapy and local legends will combine in the lakeside sauna, where quiet storytelling will deepen your connection to Jasper's heritage. Finally, the heart of this special journey, well, this is the glacial plunge. This is when it all gets real, everybody. You've learned about it. You've heard about it. They've brought you up to speed on understanding why you're going to benefit from it. But you'll step from the sauna onto the lakeside sun deck, and this is where guests will draw on mindful breathing to dip into Lac Beauvert's crystalline waters and emerge revitalized by Jasper's transformative environment. This wellness ritual culminates in reflection, lavender cooling cloths, and a soothing neroli facial mist. Now, if you're wishing to linger, you can join a fireside gathering and a tea ceremony, or, of course, simply unwind, maybe reconnect with your friends, your family, in the JPL's pool and hot tub, the best hot tub in the Canadian Rockies, and it's not even close. It's just $89 for hotel guests. You don't even have to stay at the JPL to take part. $120 for non-guests. Lasts for 60 minutes, and you can learn more by checking out the Jasper Park Lodge online. That's jasper-park-lodge.com. The new glacial plunge and sauna experience in Jasper National Park, Canada's crown jewel. We encourage you to check it out. Treat yourself this holiday season. Make your own Jasper memories. My Jasper Memories is proudly presented weekdays, every Wednesday, in fact, right here on Real Talk by our friends at Tourism Jasper. That was for a couple people in the live chat. Boom Shanker X was saying, I think everybody needs to take a deep breath right now. Everybody needs to just chill out. We're talking healthcare. We're talking notwithstanding clause. We're talking pipelines. It can get your heart rate up a little bit. If you're just joining our Real Talk live stream presented by California Closets, independent MLAs Peter Guthrie and Scott Sinclair are guests. Let's get into pipeline talk. You're eager to get into it. The MOU signed by Alberta's Premier and the Prime Minister. We heard many different sides on this one. The West Coast perspective, David Eby says he doesn't want to see it happen. Coastal First Nations say it will not happen. We've heard from energy advocates that say there's absolutely demand and that investors will be lining up to invest in it. What do you think?
As far as investors lining up, I'm not sure. I'm kind of reluctant to say that. But I guess I would first say, though, that a pipeline to the West Coast does make a lot of sense. I certainly support the pursuit of us doing that. Across Alberta, there's wide support for pipelines and all across Canada. So, I mean, naturally, we would be supportive of taking this and going down this avenue.
You haven't always been able to say widespread support across Canada. Attitudes have been changing. It's been very interesting to see.
Yes, there's been a lot of promotion that's gone on with this government in other jurisdictions, and that certainly has been helpful. There's no question about it. I think this deal, though, in particular, has issues. One, Pathways Alliance deal. There will be a pipeline, and it's going to have carbon dioxide running down it. The Pathways companies associated with Pathways, they have not put forward any capital budgeting yet or operational budgeting. So I think that offers us some real issues because they are expecting at least 2/3 of the capital to be picked up by government and operational dollars. Those operational dollars are going to come in the way of increasing the carbon levy as well as direct dollars. So what exactly is that going to cost Albertans? I'm not sure. Now, to your question off the top about a pipeline to the coast and there being a lot of interest, while TMX was greater than 600% over budget.
Yeah.
So if any organization that's going to be building this pipeline, those kind of numbers, those will cause you to go bankrupt. So they're not going to do it without government backing and possibly and probably the government being in partnership with that organization in order to give them the insurance and the monetary backing that they would need in order to build that pipeline. So what ultimately is going to be our investment in this project with all of those overages? That really needs to be understood. I think this has more political motivations than it does having detail, and that's problematic for Albertans.
Yeah, I agree that Canadians support pipelines. I support pipelines. I'm from Northern Alberta, so Jason Kenney won an election. What was his line? Like pipelines and jobs or something like that. So it's a winning idea, but like very very much. A lot of the things that are happening right now with legislation and policies from the Premier are symbolic, like the Bill of Rights. She has this international agreements bill. The bill they're about to table with firearms legislation is going to have some trouble jurisdictionally, but it is a popular idea. Those are, I think, desperate and weak attempts for the Premier to be able to sell ideas because the core services that we all pay taxes for in the province, she's losing on, and she like the massive deficits, and then using the same excuse that Rachel Notley used under the NDP, which was a low dollar figure with a barrel of oil. I just don't think that's going to fly with the majority of Albertans. Let me
say this is like, I think that it's obvious that it's relevant.
Yep.
But I think that governments that look to take credit for surplus when oil's riding high, and then blame the price of oil when they're running deficits or ignoring the expectation that most people would have that, number one, you've got to budget more prudently, and number two, you got to diversify your economy. And I'm not an economist, and I'm not a politician. I'm just an average guy with a microphone, but it sounds to me to be pretty obvious.
Yeah, I think you can't really have it both ways. I think but that's sort of the Premier's modus operandi. I don't know if I'm saying that exactly right, but when the pipeline deal is an exciting announcement. It should have been for Conservatives in Alberta, the idea of it. In practice, I agree with Pete on like the value for money and making sure taxpayers aren't carrying the burden there for like the TMX. But announcing it at your AGM in front of a room full of people and getting booed on it is a wild moment, I think, in Conservative politics, which is just reaffirms that the decision that I made and that Pete made to be able to go in a different direction every day that goes by, and we continue to watch It just feels like we're doing the right thing and trying to promote more of a right of center government. And I think Donald Trump is absolutely pushed people outside of Alberta into the pipeline conversation, and that's the reason I think you're seeing it across Canada. And I wouldn't. The Premier's certainly going to take some credit for promoting the pipeline, but I think definitely Donald Trump has more to do with it across the country. And there's a large pushback from people that if we want to have energy and independence from the United States, we need to be able to get our energy elsewhere.
And it's interesting that you bring up the U.S. into this because the approach that the Premier is taking on this, I think, is problematic. When you say to British Columbia, we're coming across no matter what, you're not going to have a say. We're going to work with the feds, and we're going to bulldoze our way across your province. Immediately, anybody is going to get their back up about something like that. They're not going to appreciate that kind of approach. Now, in order to get this deal done, Indigenous negotiation has to be done by July 1st, so in 7 months. So you're starting from a place of enforcement, of conflict. And that's a difficult spot to come from when you have to negotiate a deal in a short period of time. So I think that a softer approach here would have been the better one, to try to reach out to EB, to try to have some sort of agreement initially, at least, that we could talk, versus we're going through.
I think that would go for the Indigenous people. I wouldn't want to speak for the coastal First Nations specifically, but I think a lot of the First Nations and Indigenous communities and leaders that I speak to about it feel like that they're looked upon as roadblocks or anti-economic development, and they don't necessarily feel that way. They certainly have environmental concerns, which are real, but lots of times they just want to be included in the process, and that means from the beginning, not at the very end, and they're like a check mark to check off a box, and it's my way or the highway on this deal.
Sure.
And I think you would see it would be much easier to be able to get them to sign off on deals like this if they were included in the process from the beginning. It's the same problem she had, when I say she, the Premier had with the Sovereignty Act, is right away they got their backs against the walls, and then she had to go back and backpedal on it and make some changes to be able to protect treaty rights. So I think if the First Nations are viewed as partners and are valued members of the stakeholder aspect of it, I think you'd see some support on the Alberta side for sure. And again, I wouldn't want to speak for the people from the coastal First Nations.
I don't think that you are, and I don't think it comes across that way. I want to circle back, and before we run out of time, and Pete, you've been scribbling madly over there on something, so I want to give whatever it is you're writing down, I want to give you a chance to talk about it. But you sort of casually mentioned that you suspect, or I won't put words in your mouth, but you mused about the idea of Danielle Smith being, basically a mutiny that they'd be coming for, that she'd be replaced as Premier. It would not be the first time that's happened in Conservative circles. It wouldn't be the first time it's happened to an Alberta Premier. Who do you think would be doing it, and what gives you reason to believe that it could happen right now? What would be the impetus? Is that she's not moderate enough, or that she's too moderate? Do you think that there are enough full-blown, legit separatists willing to go public with their position and come for the Premier? Johnny's our pop culture expert here. Who was it that said, was it Jay-Z that said, if you come for the king, you better not miss? Wasn't it? Or maybe you guys, maybe I'm not giving you, wasn't it? Johnny's just laughing and shaking his head. Was it someone in our live chat will know? I think it was Jay-Z that said he'll do if you come for the king, you better not miss. Coming for the Premier, trying to take her down and rendering yourself or finding yourself unsuccessful would be the death knell for anybody in that party. So what are you expecting to see?
Well, I think the issue she has is obvious to anyone inside of the political bubble, which is she's fighting a battle on two fronts now. She's been able to try and dance this line and fence sit on certain topics and try and keep her base happy. But again, at the AGM, the Separatists made it very clear what their agenda is. So they're going to push forward and put pressure on her to continue to move not just towards separation, but I would say policies that are more in tune to the farther right aspect of the party. And then internally, I've been a private member inside of caucus and in between all of the bills and the standing up and sitting down. We talk polling all the time in re-election, and it's part of the reason I'm sitting here is because maybe I don't necessarily prioritize that as much as some of the other my members in caucus on both sides.
What, re-election?
Yeah, well, not in a sense that I don't want to be re-elected or I think I've done a good job in standing up for my riding, just in a sense that this isn't my dream job. I think that I like it, but I wouldn't be the end of the world if I had to go do something else after this. And I think some
Worst
of the members,
job of my life.
Some of the other
Worst
members
job
are
of your life?
only thinking about it.
But vote for you.
But I think reluctant leaders are the ones we should be looking for when it comes to politics a little bit. Regular people,
people that aren't in it for the money, people that don't need the job, people
That's right.
for whom this is not their greatest achievement. I totally agree.
Being relatable, I think, is important, and then also being a regular person. There's a line from The Dark Knight, if you like the pop culture references, Ryan. But
I've got a fact check.
But he says they're having a dinner between Harvey Dent and Christian Bale there, and he says, "You either die a hero or live long enough to become a villain." And I don't mean about death, but I mean when it comes to politics, I think there should be term limits, and I think that lifelong politicians start prioritizing their policies in the party instead of the people, and we're not better off for it in government. Now, where I was going to say, just to circle back to my long-winded comment there, is that you asked a very specific question about her, and I would say that she's getting it from the one side with the separatist pressure, but certainly there's people inside the room that I've been in caucus when we've talked about the Alberta pension plan and how we had to move away from it. It's an absolute loser in Calgary. So there's caucus, and I'm not going to speak for any of them, but there definitely would be concerns about it, and the concerns from the moderate members in there, like what are we going to win on in 2027, is the conversation I would be having if I was still in caucus. And I don't know how to answer that to people, because if the pipeline's not built and it's still just in an idea phase, and if we're looking at possibly a $40 billion deficit by the time she's done, which is right up there with Trudeau and Notley, so that's not a win. Overspending, and then healthcare's gotten worse, and we're not. Those core value things are going to be tough for moderates. So I'm not specifically saying there's a coup happening, but it absolutely would not surprise me that she's pushed into a decision that maybe she doesn't want to make, and then caucus pushes back. Sorry.
So what you guys are hearing right now, I'll just let the audience know it's just firing up. So we have a great agreement with our new neighbors. They're moving in. This mentions for free the Druid Irish Pub. I'm not sure if you heard, but they're opening.
Oh, nice.
Yeah, they're opening later this month, and they've been amazing in holding off their construction crews until 10 a.m. every day. But it is a 10 a.m. hard start. You're about to hear saws and drills and hammers, and it's going to go nuts. So we're going to wrap this conversation up. I'll let the audience know the door's always going to be open to you two and members of other parties as well, as we continue to have conversations across the political spectrum. But before I wrap, I want to give you a chance to touch on whatever it is. I know that you were making some notes, and there's got to be something that you want to put in front of this audience before we say
This is
goodbye.
the way I work.
That's just the way you
I'm
work?
scribbling. I mean, I guess the last
Can
comment.
I show this on camera? Can I just show your book on? There's nothing. They won't be able to see what the words are, but you got to show this. Lord, look at this. This is incredible. Your brain works very similar to mine. Look at these notes. Would you guys be able to read? Look at this. That's absolutely amazing. Johnny will tell you that my chicken scratch is very much the same. This is how I write notes to myself, so you can see. This is an absolute disaster. It all seems to work out. Any closing remarks? Anything to wrap with? Is it true, by the way, what MA said in our live chat? Said the way that I don't know about the speaker. Maybe you can say. It says the way you've been treated by the speaker, by members of the UCP. I don't think she said deplorable, but has it been a thing?
I can tell you that there's a former UCP staffer that warned me as we were coming into this session that the speaker had been instructed to get in my way. And it does feel like that has been happening. I'm getting, just yesterday on some points of order that I was addressing, I was told that I cannot speak about external things outside of the legislature, and I cannot provide my opinion in dealing with my points of order. This is on two separate occasions by the speaker. So I got to say it's pretty. I don't know. It doesn't feel good, and it's certainly bordering on privilege, a point of privilege.
And I'll try and be brief because I know we're headed out here. But
I got all the time in the world. I got all the time in the world. I'm just concerned that the saws and the hammers are going to start interfering with our conversation.
I think specifically when Pete speaks, a lot of his questions that he's had since he's been an independent have really got them off their game, and they've shown a lot of undiscipline, and they're very sensitive to some of these topics that he's talking about, and it's because they're true. And he first made concerns inside of caucus, and yesterday, to his credit, Minister Jones confirmed, in basically an admission of guilt, that and the same with Athana Mentzelopoulos, that there was obvious conflicts of interest inside of the Alberta Surgical Group and the contracts there. So the reason that I think they're testy and they're so emotional, specifically when my former colleague here speaks, and maybe a little bit towards me, is they're trying again to muzzle us. They don't want us talking about these corrupt care situations, and I think the public is going to start to see when the Auditor General's report comes out and the RCMP reports come out, and we don't know when that is, that they'll get a really fulsome picture of what this whole thing looks like.
One, there's a big difference when then versus the NDP standing up and speaking when you have a Conservative who is standing up and speaking against them. So when the UCP are sitting there, they're listening to me answer my questions. They know that I have the insight. I was a former cabinet minister. They know very well that I know what I'm talking about. They can get insulting. They could try to get in my way as much as they possibly can, and they have been. But they certainly know that I'm speaking the truth. The last thing I would say is Matt Jones. He's the Minister of Hospitals. To your point, he did cancel those 2 surgical contracts, the ones that were going to Sam Marish and MH Care and Associates. I don't know Matt's thought process on this, but Matt is a good man. He's a good person. He is financially astute. I'm sure, knowing him and knowing his personality, he took a look at those deals. He said, these are bad deals for Albertans. We're canceling them, and we're going to go back out to public procurement again. He's a good person, and I like what he's doing.
And I'd encourage everyone to read the Carrie Tate article that came out through the Globe and Mail. That she does an amazing job of trying to establish a timeline and all the players involved in this case, and I think it is... it's wildly important to get this information out to the people so they could see for themselves and make their own judgments.
Yeah, you're talking about it's a feature piece, an investigation. It's like 7,000 words or something. It's pretty wild, with Tom Cardoso, Carrie Tate, Mark McKinnon, and Stephanie Chambers, titled Who is Sam Marish? It was published this weekend on Saturday, as a matter of fact, 29th of November at theglobeandmail.com. By the way, guys, it was initially a 19th century saying attributed to Oliver Wendell Holmes Jr. and Ralph Waldo Emerson, where Emerson told Holmes, when you strike at a king, you must kill him. But the line was famously popularized by the character Omar Little in the TV show The Wire.
Oh, nice.
Cool.
I was certain that Jay-Z
So not
had it.
Jay-Z.
I thought Jay-Z had it in the lyric. I was like, I'm sure. Maybe there's a Jay-Z lyric somewhere. I don't know. My friend Jill is a big Jay-Z fan. Maybe she'll text me and let me know. Guys, thanks for your candor. As always, the door is always open. We appreciate your availability. Independent MLA Scott Sinclair out of Lesser Slave Lake, Peter Guthrie out of Airdrie Cochrane in our feature interview today, presented by Mercedes-Benz Edmonton West. These interviews happen with the support of partners of Real Talk, like North Road Investment Council, and you can find them online at northroadic.com. When it comes to investing, a lot of people, more and more private clients, in fact, institutions even, asking the same question. If most mutual funds don't keep up with the benchmark, why not own the benchmark itself? Research from Standard & Poor's in 2024, S&P, right, shows that more than 80% of Canadian equity mutual funds are underperforming the index that they track. That's a big deal. So at North Road Investment Council, they build customized passive portfolios designed to capture index returns while still respecting your values and preferences. And so that means that you can customize, if you want to exclude companies, for example, that you're connected to as an executive, or you need to avoid industries like guns or tobacco in your portfolio just based on your personal inclination, or maybe just even design your holdings for better tax efficiency. For families or institutions with around $2 million or more to invest, North Road can create fully customized factor portfolios within Canada and the U.S. North Road celebrates the fact that markets are competitive. Reach out to the team today at northroadic.com to learn more about building your custom portfolio. On the heels of Giving Tuesday, we continue to ask you to support as best you can Youth Services this holiday season. In particular, make Christmas brighter for their youth. These are young people that are going to be entering the workforce after participating in UCAN's Ready to Work programs, the Verto program, the Road to Work program. Give the gift of confidence this Christmas. Oftentimes, it's the little things that'll make a big difference. For a young person entering a new job, it could be a bus pass or warm socks or a coffee card. Fill a stocking this Christmas that removes barriers and builds confidence for young people starting their first jobs. You can stuff a full stocking for $100, or you can pick item by item at ucan.ca. It's absolutely fantastic for us to have an opportunity to talk to you about what's happening at Athabasca University. And I know for a lot of folks, this is the season where you're going to start to look ahead to what 2026 will mean for you. Is it going to be going back to school? Is it going to be re-entering the job market? Whatever it is, Athabasca University has a fit that'll work not just with your schedule, but with your bigger vision. You can learn more about the AU Advantage by checking out their website, athabascau.ca. Whether you're transferring into AU from another program or a first-time applicant, a mature student, or maybe just wrapping up high school, you can learn more about your online experience by checking out athabascau.ca. And as we prepare for another Alberta Wins feature, that'll be on the next episode of Real Talk every Thursday. Our friends at Play Alberta set the stage for us to celebrate Alberta success stories on the national or international stage. With casino winners every hour, jackpots worth millions, and revenue that stays in the province, there's never been a better time to sign up at playalberta.ca. Right now, Real Talkers can score a $50 casino bonus when you make a minimum $50 deposit with the code RYAN50. That's RYAN50 for a $50 casino bonus. At the Play Alberta app or playalberta.ca, you must be 18 or over to play, and if you do gamble, please use your game sense. John Hicks, we got a pull shoot here because the hammers and the nail guns and the saws are going. I'm super excited for the Druid to be opening up later this month, and as we welcome them to the historic Mercer Warehouse in downtown Edmonton. But I just wanted to thank our Real Talkers today in the live chat. There's been an incredible conversation unfolding here, powered by Park Power. MetaModern says, I'm willing to hear those two guys out and give them a fair shake. They don't strike me like what I'm seeing from the current UCP. Ms. B says, I really think we are coming to the point where we can no longer speak on the drivers of political decisions without also speaking about religious extremism. That's an interesting point. We also have questions from those of you that are wondering about the plans that these two will have for seeking re-election. I thought that was an amazing candor from them. Scott says it wouldn't be the be-all and end-all if he didn't do this job anymore. Pete says it's the worst job he's ever had. I love hearing that from politicians, to be honest with you. I love it. Leslie says her great uncle was George Prudhomme, Minister of Mines and Technical Surveys, his constituency, Edmonton West. Look at that, a throwback to those that came before us involved in the political process. We want to let you know, Real Talkers, as we wrap this episode, that we will, of course, follow up on what we heard today. There were a few bombshells that dropped on this episode, wouldn't you say? Whether it was the healthcare card numbers, the healthcare numbers that are out there, the idea around Danielle Smith facing a coup within her own party or otherwise. We've already got an email from a physician here, and I'm not going to say his name until I confirm with him that he's cool with it, but he's writing from his work account, which lets us know that it's a verified perspective. We always appreciate that. You can send us your feedback to talk@ryanjesperson.com. Coming up on the next episode of the show, booked in right now, we've got Dave Berta, one of Alberta's original independent political commentators, and he's out with his Best of Alberta Politics survey results. He'll be announcing those exclusively on Real Talk. We're also going to, of course, check in with other newsmakers through the day, and that includes Thomas Lukazik. Now that his petition's verified, what next? We hope you'll join us then.
Real Talk is hosted by Ryan Jesperson, executive producer Josh Dunford, technical producer John Hicks, general manager Katie Cook-Chivers, account coordinator Lawrence Derlego, human resources Lena Shepard, website design Mike Johnston, voiceover by me, Carrie Skelton, member emerita Julie Rohr. Real Talk is recorded in Edmonton, Alberta on Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, home to the Métis settlements and the Métis Nation of Alberta. Real Talk is a relay project. For more, check out ryanjesperson.com.